Hi everyone, I'm Dr. Magita Shamsundar. I'm the founder and CEO of a startup called Connecting Blood. Now I've come along to talk to you with some questions that people might ask about their fears or their doubts about blood donation or about looking for blood. So we have a couple of questions. We can start off with one, but if you have any questions, you can always comment below and I will try to go through it with you in a simple way as possible. Now, one question that people might ask is, what is the process of blood donation? Because if you're a first-time blood donor, you'll be a little worried about what happens. If you're a regular donor, then you know the procedure and it's quite straightforward and you can always assure your friends about the process. But if you're a first-time donor, it is quite daunting. So what happens is you'll go to the blood bank or the hospital where you're going to be donating, or at a blood donation camp. The medical officer there will take you through a series of tests, like a mini medical checkup, like your weight, your hemoglobin level, your sugar levels, everything. So they'll run through they'll have a form. So they'll run through the form and make sure that you're eligible to donate blood, because the last thing we want is for someone to donate blood and then feel faint or anything like that. So we want to make sure that the donors are fit enough before they donate blood. So they'll ensure that you've had a meal first, so that's the most important thing, and then they'll take you through the mini medical checkup. So then you'll be taken through. You'll either be given a bed to lie on, or it'll be a chair that you can lay back, and the nurse will bring along the blood bag where the blood will be collected, with a needle at the end of the tubing. It's a very small needle. You don't have to be worried about that. And there's just a tiny prick in your arm. The needle is inserted, and then about 10 to 15 minutes you'll see the blood coming through the tube and collecting in the bag. So 10 to 15 minutes and then you're all done. That's it. So, and afterwards they'll give you some juice and some biscuits and ask you to wait for about 10 minutes to make sure you're fine. The blood bag will then be taken through a series of tests. So it's not like some people might think that it's not directly taken for transfusion to a patient. No, it has to go through many tests before it's been cleared for transfusion in a hospital or anywhere else. So this is the process for blood donation. It's quite straightforward, nothing to be worried about.